Well, hello and welcome to the 27th Degree with Chris and Nancy, being broadcast from the Bioskills of Northeast studio in Fall River, Massachusetts. Our guest today is Amanda Chhoflet, the Dean and Associate Clinical Professor of the School of Nursing at Northeastern University, Bouvé College of Health Sciences. Did I say that right?
You
Bouvé or Bouvet?
Bouvet, I think, but
Bouvet, okay.
yeah.
Got it. Before we begin our conversation, I'd like to thank our sponsors, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit Bay Coast Bank or call 508-678-7641 to learn more. In Duncan Hearing Healthcare you can trust with sites in Fall River, Dartmouth, Falmouth, and Centerville. For more information, visit their website, duncanhearing.com. As always, you can support the 27th Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform, and by following us on Facebook and Instagram. Also, please remember to leave a review. So, why don't we start with tell us a little bit about yourself? We'll start with that. Tell
Oh
the
my,
audience who you are, and we'll get into we'll have a nice discussion about nursing.
oh, that's fabulous. That's great. This is always like the most dreaded interview question. Tell us a little bit about yourself.
Right.
I
Always.
agree.
Sorry. So I'm actually an oncology nurse. I originally trained as a certified nursing assistant when I lived in Denver, Colorado, and then I got my associate's degree from Community College Denver. And started immediately working on an oncology inpatient unit. And I've just never stopped going to school. And I have completed almost every degree that you can get in nursing. I became an LPN and then an RN. Then I got my bachelor's degree and then my master's degree and then my clinical doctorate. And kind of
Great.
all along the way, I was able to work in all of the different kinds of healthcare institutions. So
Mhm.
I've got experience in acute hospitals and ambulatory sites and infusion centers and um, a little bit of primary care, some surgical care. Just if you
Nice.
name the type of nursing, I've probably done a little bit of it,
That's
uh,
great.
including
That's
global health.
awesome.
So I've gotten to spend some time in working with nurses outside of the US as well. And my favorite job of all is being here at Northeastern University, where I get to help be a part of this amazing school of nursing that's just trying to put our resources where we think they're going to be of the most need. So
How long have you
So,
been there currently?
I came to Northeastern in the summer of 22. So this is
Okay.
my starting my fourth year at Northeastern. My
Okay.
second full year is the my I've been the dean now for 2 years. I'm starting my
For
third
two
year as the
years.
dean.
Hmm.
Yep.
so
That must
Amanda,
be an interesting job.
one thing I'm going to add to your biography is congratulations on being the recipient of the 2025 American Nurses
Oh,
Association Massachusetts Excellence in Nursing Education Award.
thank
That must have
you.
been great, especially when your colleagues nominate you for something like that.
Well, you nailed it. That was exactly, I mean, that was among the most humbling professional experiences I've ever had. And it was the meaning of that award came entirely
Whoa.
from being nominated by my close colleagues. I mean, I just it was very
Yeah.
humbling. I wish it,
Yeah.
I felt like it was an award that we all won because the things that they wrote about in the nomination letter were, in nursing, it's a
Yes.
team sport. You never do anything
Yes.
all by yourself. And the accomplishments were all things that we did, that we did together. So I feel like it's my name on the award, but it's really a school of nursing. Of course, I'm going to keep it.
That's great. That's great. So now you've been in Northeastern now for a couple of years, couple 3 years.
Yep.
Why don't you tell us just a little bit about the school? And you said it's your favorite job. Why do you love it so much, and why is it so different from like other colleges?
Well, Northeastern University is a very unique place because it is a very forward-thinking institution, just the university itself. And so the School of Nursing that lives inside of Northeastern is also it tends to be a little more open and flexible and kind of thinking about new ideas. We are not afraid to do things differently than we've done them in the past. When I came to Northeastern, the School of Nursing, which lives inside of this amazing College of Health Sciences, Bouvé College, had already expanded to 3 sites. So we have campuses in Boston, that's for our traditional BSN and direct entry program. We have a site for our School of Nursing in Burlington, Massachusetts, and then we have a campus in Charlotte, North Carolina. And what we needed to do was really build out the infrastructure for the school so that the school doesn't run like 3 different independent but loosely affiliated campuses, but rather runs like one school so that each of these sites can really benefit from the resources that come to bear when you have a 1,500 student school rather than a smaller site, with, just a handful of full-time faculty and a few hundred students. And so our school really operates like that, where we're very local, hyper local in our focus when it comes to the clinical experiences, the patient populations that we're, working with students to care for. The faculty and staff are all from the local areas, where the sites are located, but we have this global outlook. So we are really trying to build our students' perspective so that they see themselves as nurses who are involved in the nursing community worldwide, and having a global campus where we have this networked, these networked opportunities, it really helps that. I mean, the students, I think they have, I don't know if it's a Slack channel that students at our various accelerated program sites actually share a social media. I'm not on it. This is not for faculty. This is students only, from what I've heard. But the students can really connect with each other to provide support and encouragement and curriculum hacks and things that are helpful across multiple campuses. And I think that most schools of nursing don't really function that way. And I think it really is a benefit for our faculty and students. And staff.
Yeah, of course. Just to have that transparency across all sites. I mean, you need all the help you can get, right? When you're in nursing school, because it's not just, I mean, you don't know where these students are coming from, what kind of family dynamics they have, depending on their different responsibilities linked to what ages they are.
That's
it's crazy what their work history is. So just that network, oh my God, so valuable, right?
And it really tees us up to do some innovative programs. So one example is we have a research scientist who's trained as a social worker on our team. And she's working with a nonprofit organization that does substance use education. And because we have so many different programs spread out across more than one state, she has access to student populations to pilot some of this education and provide real-time feedback about the substance use training that otherwise you'd have to really network with multiple institutions in order to pull that kind of, beta testing or evaluation support back. And here our students are getting the benefit of this highly innovative, like just-in-time substance use education, and the science is kind of moving forward because we're getting evaluations that really are not just located in one geographic region with one type of student with,
I was just thinking of that. The diversity is incredible that you can pull from.
Yeah.
That's great.
And then our students have access to, lots of different patient populations that, they frankly need to be training with while they're in school. So it's a very cool place. It's a very cool place to work.
Now, you mentioned you use the term accelerated program. Can we talk about the accelerated program and what that is?
Yeah. So in nursing, and this is, I think we started graduating accelerated bachelor's degree students 15 years. I think some of the first programs are going on 2 decades old. Traditionally, nursing school, and this has not changed for about 100 years, nursing education. So traditional university-based nursing education, I'm not talking about the diploma programs that aren't as widely available anymore. But university-based nursing education takes 4, sometimes 5 years. Students do usually the first year to year and a half of their prerequisite work, and then they start taking nursing classes sometime at the end of their sophomore year, beginning of their junior year, and then take the same like 6 clinical courses that they've been taking ever since I went to school, probably since Nancy went to school.
I know. OB/GYN, geriatrics,
adults 1, adults 2,
PD.
maternity, peds, psych, mental health, and public health.
Got it.
And it's been that way since forever. And different schools have different kind of flavors, for how they package those clinical experiences. And the amount of time that it took a student to get through that program, it's a little bit arbitrary. We sort of nursing backed into a university education. It didn't come from a university-based education, right? We took diploma-based programs and backed them into, okay, what does this look like as a 4-year degree? And so in part, I think due to the nursing shortage, which has, waxed and waned, but never really gone away my entire professional career, there has always been this drive to try to, without compromising quality, accelerate the production of nurses. So can we take highly skilled, highly qualified nursing students or applicants and get them through an accelerated program and produce practice-ready nurses in a shorter amount of time than kind of the arbitrary 2-year nursing, plan of course sequence plan. And so that's what our program does is we take students into our accelerated program and they can get through it in 4 semesters. And because we've divorced, because we go over the summer, we actually have 3 trimesters per year. A student can get through our accelerated program in 16 months. And they come to us, though, they have to have all of their prereqs done. And most of our students already have a bachelor's degree under their belt when they apply to nursing school. So it's almost like they're doing nursing school as a post-bac. Well, it is. They are doing nursing school as a post-bac. A little like closer to how you might think of med school or, some of the other clinical professional programs. And then they take between 16 and I think 19 credits per semester, might be 18 credits per semester.
I was going to ask you. Yeah.
Very rigorous. And,
that's quite a bit.
Yeah.
Yeah.
You really shouldn't work.
It's like maybe 3 or 15, right?
Yeah.
So you can like 18, 19.
Yeah.
That's a little bit tougher.
And remember they're doing clinical rotations almost from jump. We just rearranged the curriculum a bit because we wanted to have a little more of a runway into the clinical experiences. And so we used to put people directly into the hospital within the first couple of weeks of starting nursing school, which I think is, you probably could use a little more time to get your wheels under you. So we just launched a new curriculum this last fall. And with our new curriculum, we put those students in fairly high intensity labs and, with more of their fundamentals courses in the first semester. And then they jump into their clinical rotations in their second semester. And then they're in clinical second, third, and fourth semester.
Culminating. How unique is the program, the accelerated program? Are there other programs out there, or is this really very unusual?
They've become a lot more common than they used to be. And each accelerated program, like I said, has its own kind of unique flavor. So there are some programs in our area that do something called more concept-based learning. Well, they'll take body systems and then teach you all about every patient population that you might encounter related to that body system. So like cardiovascular care, what does it look like to take care of a pediatric patient or an adult patient or a gerontological patient or whatever. That's not our current approach. We take more of a population-based approach and walk people through at each population or level of care, what are you likely to encounter from a baseline of, very solid anatomy and physiology, pathopharmacology, and then
Right.
basic fundamental, kind of nursing science framework. So, but each of these accelerated programs has a little bit of a different focus. And so each program works for different kinds of learners, which is one of the reasons why it's really good for people thinking about coming to an accelerated program in particular, that they really take some time in the lead up to enrolling to get to know the school, make sure that you get along with the faculty if they have
Make sure
share
it's the
days
right
on
fit.
campus.
Sure.
Yeah, exactly. I always
Yeah.
say to people, like, when people don't succeed in nursing school, it doesn't necessarily mean they can't be a nurse. It might just mean that they ended up in a program that wasn't right for them, because
That's a
there
good
are so
point.
many different kinds of programs. So our program is right for a lot of people. It's not right for
Right.
everybody. But I love it. And I think the changes that we just made to the curriculum are make it a very strong program.
Yeah. I
Yeah,
think it's
that's
like
what I,
that in, college and med
Yeah,
school or any program. If you
any
go to
program.
a program that doesn't fit you, you're not going to succeed to
Right.
the level you would otherwise. So, and
That's
it
right.
is amazing how they're all so different. My
Yep.
daughter right now is applying for a master's program and in social work, and they're all incredibly different
Yeah.
throughout the country. But let me ask you this. Let's talk a little bit, if you don't mind, about the nursing shortage, because
Yeah.
that's, I think, a very interesting topic to get into. First of all, why is there a nursing shortage? It seems like such a fabulous career path, and I'm always surprised, that there is, but there is.
I mean, how much time do we have? We've
I'm gonna interrupt for a sec. Can I just go
Sure.
back before we get into this topic because
Yeah.
it's so heavy with the content? Can I just go back to the Northeastern program and the affiliation with Bioskills? Because I
Yeah.
find that, like, I think people want to know about that, especially in the Fall River area. I
Yeah.
had just a couple more questions for Amanda. Chris, is that okay? I jumped in, I stomped on your feet. I'm sorry.
Yeah, no. So the Bioskills connection is actually a great story. Alex, who is, gosh, I think he's, forgive me, he's the CEO of
Yes,
Bioskills. Yes.
yes.
I
He's
think
a
so, yeah.
Northeastern alum. He's a Husky,
Nice.
and he connected us with Primacare and with St. Anne's. Gosh, it was probably going on 2 years ago now, because this was um, before St. Anne's partnership with Brown. Back in the olden days, and they were noticing that they had a very hyper local nursing shortage. It was just the turnover
Yes.
rates at the bedside were more than they it was just placing a heavy burden on their ability to keep solid nurses um, on their floors. And when we started to look around at the other hospitals in the Fall River area, it really felt like there was a gap, like that a very local nursing program could fill. And it looked like the nursing schools that are already here, that are wonderful, are at capacity. And so the last thing we ever want to do is come into a new place and edge out another school that's already doing a great job, or show up and offer a program that nobody's asking for. But this was the opposite situation.
Yes.
So we started having some very productive meetings with Bone, with Primacare, with St. Anne's, and some other kind of local community members, but primarily with those three partners, and realized this is a match made in heaven, because Bone could connect us with the physical space that that we're now
Mhm.
sitting in. We're one floor below them, and they've got this beautiful interprofessional space that attracts people from all over the world to do highly intensive trainings. We're
Simulation labs. Yeah,
Yeah, and we're
fantastic.
basically
Yeah.
co-located, and we have space that's specifically designated for our nursing students, but also can, you know,
Yes.
can do collaborative things whenever, so it gives us a lot of room to grow in the future. And again, it all came from relationships. As a very good friend and colleague has always says to me, relating comes first. Relationships always come first.
Right.
And I think that's really that's the glue that holds our whole school together. And that is one of the things about Northeastern that you can always rely on, is we really work on building strong community-based relationships, and then keeping those relationships at the center. So,
And I had two more follow-up questions
sure.
on things that you said for the program. I really liked what you said about people that maybe just want to change their career. Do you find that it
Yeah.
doesn't matter what career they're coming from? Like if I'm just like, I'm a CPA, I want
Yeah.
to be a nurse. Or like I'm a social worker and I want to
Yeah.
be a nurse. Are professions, have you ever found a link like that are tied to professions being more highly correlated with success in a nursing program, or it just kind of depends on
Actually,
the
you know, that's a
person
that
and
is
what's
such
in
a
their
great
heart?
I'm writing that question down because we are always um so we have had students in our nursing program from who started off in so many different professions. We had, I
Sure.
think we had a graduate maybe a year and a half ago who was a practicing psychologist, wanted to come back from nursing school. We've had people who are, 20 plus year primary school teachers. We've had people
Right.
who are artists. So we have a variety of students who are looking for sometimes an early life change, sometimes a midlife change, and sometimes a later in life change. They'll retire from their first career and come back to
Yeah.
nursing school for an entirely new career in retirement. So it really does run the gamut. And when people come into these accelerated programs, they are geared for adult learners. That
Nice.
places a heavy burden on the student, though, because adult learning theory is really about active learning. It's about kind of using a flipped classroom. So a lot of the didactic material is presented to you asynchronously, and
Yep.
there's an expectation that you're going to kind of engage with the materials, do the, things on, in the Canvas, in the learning system that we operate.
Mhm.
And then when you come onto campus to work with faculty and the clinical instructors and your preceptors, that you're really there to apply the materials that you have been engaged with, either synchronously or asynchronously. But, there's a lot of active learning that these programs require. So you have to have some kind of life experience, I think,
Yeah,
in order to
of
be
course.
successful with that. But it doesn't, I haven't seen a direct correlation with age or a specific, kind of life
Mhm.
experience. It's just,
Yeah.
you have to be ready for what
Yeah.
the material is asking of you. I do think that our students who have some sort of exposure to, even if it's just share days with the clinical environment, they're less um, shocked by it. I think if you've never spent any time in a clinical environment, whether it's inpatient or outpatient, I think that there is an energy about it, and even like the smells and the sounds and the the activity going on around you constantly, for some folks can be a little bit overwhelming. And so I always recommend, if you're not sure if you want to go to nursing school, but you think it seems like a great idea, then you should go on a share day. Find someone in your
Mhm.
circle who works in a hospital or an ambulatory care center, and who can connect you with someone who can let you spend 6 or 8 or even better 12 hours with them, so you can
Yeah.
actually walk the walk of a
Great
nurse
idea.
before you make that lifelong commitment. You don't want to be halfway through
Mhm.
nursing school
Right.
and then realize, oh no, I don't want to
Not
be a
for me.
nurse actually. So
Right, Amanda, I have two
Uh,
observations and then I'm handing back to Chris, the nursing shortage
that's okay.
question. My two observations when I was just looking at the Northeastern website, I was very excited to see, because times are tough financially for people. You're offering a $15,000 scholarship for this particular program, which yay. And then I
yeah,
love, love, love the idea that you do three separate start dates because
yes,
it's just so fluid. I love
yeah.
that. Who thought of that?
We've been this predates me. This is actually our first accelerated bachelor's program opened in Charlotte, North Carolina. And we've been doing 3 start dates ever since we started an accelerated program. And I think it keeps the program as accessible as possible. You
Yes.
miss, you forget about a prereq, or you can't get into the class that you want, and you miss the fall enrollment deadline. Well, spring is just a few months away. Like, it's not, we're really trying to meet, we're trying to meet people where they're at and get them where they want to go.
Life happens. I love
That's
the
right.
3 start dates. It
That's
doesn't,
right.
throw you out for X amount of months. Love it.
No, that's right. That's right.
All right, Chris, all about you and
All
the
right.
nursing shortage.
No,
Why do we have a nursing shortage?
Yes, let's get back to that, because I'm curious about that.
The audacity of that question. Oof. So I think that the answer to that question really depends on where you're situated. And so I'm going to answer you as someone coming from the academic, vantage point. I think I had a different answer back in my days as a clinical director, as a nursing director. One reason that I think we have a nursing shortage right now is that there is a really high turnover rate within the first 2 or 3 years of nursing in acute care facilities that we haven't totally gotten our arms around as a discipline. There are lots of people who will tell you that this generation doesn't want to work. This generation doesn't understand what it means to do A, B, C, or D. And what's always funny to me is I've been a nurse for 22 years, and I have been hearing that my entire career. No matter what generation is working, no matter what generation people are talking about.
Every generation says it about the generation that's coming forward.
Behind. Exactly. This generation doesn't know the value of,
I think there's some truth to that.
What I love about the generation of nursing students who are coming through right now is that they are advocates for themselves and their patients. I think that it is I think it's beautiful. And this is exactly what we need in order to change the structural deficiencies that have been driving nurses from the bedside for so long.
Yeah.
So I think as a system, like as a healthcare system, not that the healthcare system is us, so I hesitate to use that word, but we who are helping to make decisions, or who are crafting, what this system looks like, or these, different components of the system look like, have to take a hard look at the kind of environment we're bringing nurses into, and whether or not we are supplying the nurses who are doing the actual labor of healthcare with the material resources and support that they need. That's not just for nurses. That extends to the entire interprofessional care team, because in my, in my other life as a researcher, I have been studying clinician mental health and suicide and substance use for a number of years. And the amount of psychological burden that we're placing not just on nurses, but on nurses, physicians, pharmacists, and probably every other, healthcare practitioner who is working today is much higher than we even previously knew. And we still hear stories every single day about clinicians having to wait 6 months to get in to see a psychologist, or, having to beg and plead to have their PTO days be recognized, or, to be allowed to take a day off that they've earned. We still hear, scary stories about bullying at the bedside. We have, and nurses are very worried right now about personal safety in the hospitals, and increasing levels of violence. And, like the list goes on. So we know that we have structural issues that we have to fix. The way you fix structural issues is with material resources and support, and, by changing the incentive model, so that you're actually producing outcomes that are more holistic and humanistic and, supportive, responsive to the evidence. And beyond talking about and lamenting the nursing shortage for decades, I don't see a ton of real systematic change in the way that we are administering our healthcare in this country that I think would actually, change what the nursing shortage looks like.
PrimaCare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. PrimaCare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. PrimaCare is large enough to take care of all your medical needs, but small enough to care for you personally. PrimaCare is by your side.
Can I ask you a question? Is it an overall shortage throughout all sectors, or is it more of a shortage in hospitals and acute care in that type of environment?
Yeah.
Because what I often see is that, after nurses go through their training, many of them, they'll go to med surg, they'll do a few
Yeah.
years in the hospital, and then they move on to something else. I think a lot of times because they want to get their experience in the hospital, the hospital is really a stressful environment, and
It is.
and there's other jobs that sometimes are more supportive, or I
Yeah.
guess maybe more there's more longevity, and I guess you can maybe survive longer in. But I don't know if that's the
Yeah.
right way to put it, but that's what I'm wondering, if it's just more certain sectors where there's a shortage.
Yeah, so it's such a great question. And I think that's one of the reasons why people get tired of hearing about the nursing shortage, because
Right.
it, it's actually a series of shortages that are very specific to certain subspecialties or patient populations and levels of care,
Right.
and sometimes geographic regions. So, in Massachusetts, I actually was just looking this up earlier today for a different reason. They are reporting, the Massachusetts Health and Hospital Association, MHA, is reporting a slight improvement in
Good.
the nursing shortage in Massachusetts.
That's
Um,
great.
and at the same time, in this same report, they have reported a 14% vacancy rate in med-surg nurses. So,
Okay.
so yes, we're seeing some improvement. So now only 1 in 10 nursing jobs are vacant right now, but there is there's a collection of vacancies that are centered around a few subspecialties like med surg. And for a long time, people haven't thought about med surg nursing, medical surgical nursing,
Mhm.
which is, the heart and soul of nursing. Like, this is the nursing that most of our patients will receive when they get admitted into the hospital,
Right.
unless they have a very specific, diagnosis that they're being treated for. Um, the turnover rates on some med surg units in some hospitals are
Yeah.
abysmal. Less than 1 year. They're
Mhm.
struggling to even find people who can precept new grads because they don't have
Right.
enough people who have been employed for more than a year. You hear those anecdotal stories that they don't always make it, into these survey data, um, but the struggle is real,
Are
in
are
basic nursing.
those nurses who are in med surg, and we'll use that as the example because that seems to be where there's a particular problem,
Yeah,
and leave, are they leaving to go into other areas of nursing, or some just leaving the field completely,
both.
or is it a combination of both?
It's a combination of both. And we don't always have great tracking systems. So,
Right.
at any given point, there are nurses who have graduated from nursing school and are sitting with a nursing degree who are not working in nursing. I think in the US right now, we have something like a little over 5 million nurses with nursing degrees, but only 4.3 million nurses working as nurses. So
Oh,
there's like this missing, group of
interesting.
nurses. I think I got that right.
Is that graduated or past NCLEX?
I think it's with licenses.
Oh,
I think it's
Wow.
licensed nurses. I think I
Okay.
got that right. So like, where are all these, what's happening? So some of them, yes, are leaving the profession, and some are leaving acute care nursing. Some of them are, transferring within a hospital or health system. Uh, some hospitals downsized in COVID and then never,
yeah.
never actually
Yeah.
replaced those positions after COVID. Ironically, like we have like this huge problem with the pandemic, and there were
Right.
some facilities that were forced to cut positions because they couldn't perform their ambulatory, services at the time, or their surgeries in the
Mhm.
outpatient centers. And some of those positions haven't been replaced in the last few years. So I even have concerns about if we're only looking at vacancies for currently posted positions, are we actually looking at the total need? Because these aren't need-based
Yes.
surveys
That
that
was
we're
exactly my
reviewing.
question. I'm thinking about that data and how sensitive it is to turnover rates and
Yeah,
orientation periods and everything else. Because one
yeah,
in 10 just sounds low to me,
I
you know?
know. I know,
Yeah.
but that study, that report just came out a couple of weeks ago, like
Yeah.
this in January. Yeah, I'm
Yeah.
still like, I haven't read the whole report, just the executive
Yeah.
summary, but it doesn't totally match what I'm hearing anecdotally
Yes.
from nurses at the bedside. It's not what we're
Yes.
seeing, you know, say in New York, you know, with the
Yes.
nurses strike and people really,
Yeah.
Yeah.
again, standing up for, you know, the work and labor conditions that they feel keep patients safe. Like we're just, nurses are at a point right now, and I think that this is actually really good for the discipline and really ultimately good for healthcare, where they are feeling like their advocacy and
Yes.
I think it's wonderful. I really support it. I
Me
think this is
too.
what's going to change healthcare.
Yeah, I agree.
Yeah.
I hope so, because it's really it's a problem with healthcare in general. I mean,
Yeah.
the reasons that we are struggling in primary care are very different than why nursing is struggling, but we have similar issues where people are not really going into primary care and many are
Yeah.
leaving earlier, and the reasons are different, but I think overall, if you look at it, it comes down to lots of problems in medicine right now.
Yeah.
And the problems are different, I'm sure, between what we experience and what nursing experiences, but there's probably some overlap.
I'm not convinced they're that different. I've been involved at different points with a few
Sure.
primary care advocacy organizations, because
Yeah,
this primary care, this has been a train coming our way down the tracks for,
sure, for a
you
long
know,
time.
decades. And you know, I think I would love to hear your thoughts about this, but I
Uh,
thought that some of the reasons I thought where we were at is that we believe that people are leaving primary care and not going into primary care because of reimbursement rates and quality of life. Like they can't, like when you're in
mhm.
primary care, you hand over your life because you
Yeah,
just cannot make a living as a primary care physician or primary care provider. Um, like structurally, it's just not a possibility
yeah.
right now with the reimbursement model.
Well, I mean, I think it's that. I mean, I feel very blessed to be able to do what I do. You
Yeah.
know, we're able, and I'm sure you feel the same. We're able to take
Yeah.
care of people at the most vulnerable times of their lives, and
Yeah.
I think I look at society in general. Every physician does well compared to many in society. So I don't,
Yeah.
you know, I feel very good about that part of it. And I don't want to harp on the financial piece a lot, but if you do compare, what primary care docs make compared to specialists, there's a huge difference. And
Right.
I think that, although I feel very lucky to be doing what I'm doing, I've made great long-term relationships with patients over,
Mhm.
over 25 years. And sometimes it's harder to do that in other fields. Sometimes, it's not. There are specialists who
Totally.
make those relationships, certainly. But I mean, I feel very, very fortunate to do what I do. But if you're a resident and you're looking at what you want to do, or you're a
That's
medical
right.
student, and you haven't had those 25 years of wonderful experiences with
Yeah.
patients, you look at, well, this field makes this much, this field makes this much. And by the way, the field that makes a lot less, there may be a lot more that is asked of me as far as time and
Yep.
lifestyle and all of that. And so I think that that's a big part why we have maybe not as many people going into. Now, why people are leaving is a whole different story.
Yeah.
I think there's a lot of burnout that has occurred in
Yep.
primary care. I think that, COVID kind of put a lot of us over the edge, no
Yeah.
doubt. But it was already there. There was, it was occurring for many years.
Yeah.
It's the paperwork, it's the volume. And
Yeah.
what's happened is that because overhead has just steadily gone up, and
Yeah.
reimbursement rates haven't really gone up,
Yep.
we've compensated for that by volume. And
Yep.
when you do that, two things happen. One, you lose your enjoyment of your interactions with your
Right.
patients. That's one thing. And then,
Yep.
you just get fried after a while. I mean, there's only
Yeah.
so much of that you can do. So I think that's a big part of why a lot of people who, when COVID came, a lot of people left it. I was surprised left. They
Yeah.
weren't really at retirement age. They were maybe right on the edge of it,
Yeah.
but it pushed them over the edge.
Yep. Yeah. I honestly, this feels very familiar. Yeah. That was such an eloquent way um, of stating these different variables that I really do think have a huge tie into nursing. The reason that we're
Yeah.
seeing kind of
So,
multifaceted
yeah.
nursing turnover.
So maybe it's not so different after all.
I don't
You
think it
know?
is, like fundamentally everyone is being asked to do more with less.
Yeah, I
That's
think
the
you're right.
problem. And
Yeah.
we either, like, as a society, is healthcare a commodity or is it a right? And if we believe in the value of healthcare, then, ultimately, like there is a baseline at which you cannot
Yeah.
provide high quality healthcare for less money. Like just to figure
Right.
out
That's
like,
right.
okay, we're at the root. This is what it
Yeah.
costs to help provide care for, the people in our community. Let's build out the system around that,
Yeah. You brought up another thing earlier that I think is something that's kind of not discussed. Maybe people aren't aware of it as much, but I think society in general has changed, and this whole risk of violence issue is really very
Yeah.
real. Years ago, when I first started, I mean, that wasn't really even a concern. But now, I think nurses and physicians go to work and we worry about that. And
Yeah.
that is a really interesting issue that's become forward more over the last, I don't know, maybe 10 years or so.
Yeah,
I don't know.
I think about this a lot because it comes up a lot in different like working groups that I'm in. What are we doing about the violence problem? And I've been struggling with this question of whether
Yeah.
the violent incidents are increasing or whether reporting of the violent incident or like recognition that I don't deserve to be a victim of a violent
Right.
incident
Sure.
is increasing. Because I was
Yeah.
just thinking in my own, and I've thought, in my own career, have things changed or have I become more aware of it? And I
Right.
vividly remember back in 2007 being chased around a patient room
Yeah.
by
It's
a
scary.
patient who was having a mental health issue, and he punched the wall next to my head. And
Yeah.
I vividly remember walking out. I was a floor nurse at the time. I remember walking out of the room I was shaken up and I walked directly to my manager's office and reported to her what happened verbally. And her exact words to me were, what did you do to make him do that?
Wow.
And I, at the time, in my wisdom, tried to answer her. I was like,
Good.
oh gosh, I probably wasn't being as empathetic as I could have been, or,
Yeah.
I tried to take it on because I think
I
as
blame.
nurses, that's where you gain some
Yeah.
control over these uncontrollable experiences. And I'm the same person today that I was then. But if that happened to me today and I had a manager who responded that way to me, I would not tolerate it. I would not
Right.
try to answer that question.
Exactly.
I would say, oh, okay, sounds like I need to talk to your boss. And I think that's maybe a part of also what we're seeing is people understand that they don't deserve this. This isn't
Right.
okay. And thank God we're seeing more of these incidents get reported, although still the vast minority, like the vast majority of violence is not being reported
Right.
when you do more
Yes.
informal surveys. I
Yeah.
don't know, Nancy, I'm sure you've had experiences too.
Yeah, again, gosh, I've been a nurse since 1988. I'm dating myself. But there's always bad behavior has always existed. What has changed has been the normalization of bad behavior and the
Yeah.
acceptance or non-acceptance, I
And
think, of
Right.
bad behavior. And of course, I mean, you look at all the variables, there's so much that plays into that. The resources available for mental health patients
Right.
to improve
And the
has grown.
staffing, I mean, we
Yeah,
know that, poor
right.
staffing seems to be correlated with a higher
Mhm.
Yeah,
incidence of violence. And
yeah.
Makes
yeah,
sense.
I
Makes
think
sense.
there's so many variables that go into
yeah,
that.
yeah,
And I don't want to end the talk on the nursing shortage without asking, there's also been an impact through our legislation with the One Big Beautiful Bill removing nursing from the Department of Education, which, God, talk about a gut punch.
Yeah.
You-
So there, the last thing I will ever do is defend anything that's in that bill, because it's this is just speaking as a nurse, not that bill is damaging to healthcare and higher ed, as
Yep.
you know, and
100%.
that's just what it is. So, and what's interesting about the education provisions, and they are absolutely damaging, is that there has never been parity in nursing education. There, compared to other health professions, we have never had a situation where people going to nursing school for their primary, registered nursing degree or to graduate nursing education never really been funded in any meaningful way by the U.S. government outside of, some of these HRSA bills and the nurse faculty loan program and the loan payback, for service.
Yes.
Those are all those seem to be the things that are on the chopping block that people are trying to kind of remove access to by reducing the number of ways that nurses can access federally supported loans. So Grad Plus loans are going away for everyone. That's not just nursing students, but everyone is losing access to Grad Plus loans. That's just damaging, full stop, to the entire kind of future of the United States, I think. Not just for people who are born here and who go to school here, but also we have been a beacon of amazing university level education for the rest of the world. It's probably been, one of the reasons we've been able to stay ahead of, most of the rest of the world with scientific innovation. And so I'm really worried about that. Specific to nursing, this removal of nursing as a professional degree means that our nurses will have less access to publicly backed loans, which will force them into the private market, which makes them vulnerable to predatory lenders.
Yeah.
And there's no loan payback for private loans. You can't consolidate those into the public loans. And so it puts them in an economically disadvantaged situation for the rest of their loan payback period, which might be, for decades to come. So
yeah, that's terrible.
It's terrible. I mean, and there's no, you can't put lipstick on that. So one of the things that universities are trying to do, and that what we are trying to do at Northeastern, is to negotiate with some nonprofit or, not-for-profit lenders who would be able to provide our students or potential students with loans that would match what federally backed loans would have looked
I'm
like
so happy
if
to
they
hear
could
that.
continue. Yeah. So we're actively working on that right now, hoping to have something that will be ready to offer to students by the time these loans go away, July 1st. I don't know if, I'm not obviously a part of that. I'm a nurse, not a finance guy, but that is, we're trying to advocate as much as possible. It's not as good as a federally backed loan, but it's at least some sort of it's where we're at right now. I worry about losing this generation of graduate nurses. We've become really reliant on nurses going back to graduate school. That's our faculty pipeline. That's where our
faculty, no new nurses.
Where our nurse researchers come from. It's where our nurse practitioners come from. Clinical nurse specialists. It's just our healthcare system needs
a wide net,
graduate nurses, and so, or graduate level nurses, and I think that's what's going to get hit the most. So, it's bad.
Well, I didn't want to bring up all the downer stuff, but I do think it was important for everyone to hear what's going on, and I think on a high note, it's great to hear what the university is doing to try to combat some of this and deal with the crisis that's here and the shortage and all that.
Yeah. I mean, I think this is something that it's a tough moment. It's a tough moment. and you know, I think not acknowledging that feels like we're
Yeah.
it feels
No,
like
it's tough, and
gaslighting, you
I think a
know?
lot of people aren't aware of, what's going on
Yeah.
really,
And
and
all
that's
you
why it's
hear are
important to discuss.
scary things, you know, you hear scary things.
Yeah.
And what I just had a meeting with our executive advisory council last week or the week before. And, you know, and when I meet with students or talk to faculty and staff, like I think what's so key is that um, our mission hasn't changed. You know, like what we are doing in healthcare hasn't changed. We care for human beings. I think that's what we do. We
Okay.
Mhm.
we look at the person in front of us and we try to figure out what can I do to make your life a little bit better with the tools that I have in front of me. That's really what we're doing in nursing education too. You know, take each student one at a time, hopefully, you know, if we're doing it right.
Yeah.
Right.
And try to work with them to get them, you know, to the next phase of their educational experience so that they can go out and take excellent care of people who need help. And like that is probably even more important to do now and into the future. It has always been important. It hasn't stopped being
Mhm.
important, and so that gives me something to stay rooted in, even when I wake up and I'm look at the news. And, oh gosh, not
Right.
again.
Mhm.
I just sort
Right.
of I say, you know what, Amanda, like the mission is everything. You know what
Yeah.
we are doing is important and it's good, and
Right.
it's going to continue to be important, even if the outside world feels a bit daunting right now.
Right. Right. That's a
Thanks.
great way to put it.
Yeah. I agree.
Yeah. Well, Nancy, do you have any other questions?
You know, I think Amanda did an awesome job
Yeah.
covering so many
I
questions
mean,
and
it
topics
was, yeah,
and oh
we
my
went all over the
word.
place, which was great. We kind of we could do hours on each area that
Yeah.
we kind of
I
scratched the
know.
surface on.
I know.
Really could.
This has
And
been
we'd love
so
to have you back
fun.
at some point to discuss this in more detail. And hopefully
I love
we
that.
can, yeah, this was kind of an introductory, talk. I think we covered a lot of different areas, but we could
Yeah,
delve into some of these even, way more deeply than we have.
I love that. This has been a real blast. Thank you so much for having me.
Oh,
You're
thank
very
you so
welcome. It was
much.
fun
Thanks
for
for
us
being
as
here.
well.
Yeah.
Is there anything you want to leave the audience? Any one message out there?
No, you know, the only thing I'll say is that we are so pleased to be a part of the Fall River community. It's just been, honestly the one of the best things to happen this last year, in my professional life.
That's
So
great.
that's all. It's just a wonderful, part of the world to be a
Yeah.
part of.
Thank you. It's been a great place to practice for many years, and I'm from here originally, and there's a lot of good people in the
Yeah,
area. So yeah.
yeah, I know.
Well, thank you once again for being on our show. We really appreciate it, and
Thank
thank you
you.
to everyone for listening to our show. And if you'd like to become a sponsor, please contact us at 617-775-3737. Special thanks to Ron Gamache for our intro music. Primacare, your trusted medical provider in Southeastern New England. Bioskills of Northeast for producing our show, and available to produce your show by calling 774-301-8811. Bay Coast Bank, just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. And then finally, Duncan Hearing Healthcare you can trust, with sites in Fall River, Dartmouth, Falmouth, and Centerville. For more information, visit their website, duncanhearing.com. Thanks again for being on our show. It was great.
Thank you.
Thank
Thanks
you,
so much. Stay
Amanda.
warm.
You as well.
All right. Bye bye.